context of molecular characterization of relapse, I think this is an incredibly important area, because what we need to do when we assess bone marrow aspiration and biopsy for cytogenetics, which should include FISH, and recognizing that, the more sophisticated tools that we have are not necessarily available in community practice, but certainly FISH is. Why that's so important is because obviously if a patient has acquired a translocation of 1114, that's very helpful to us because it allows us to deploy a targeted therapy in specifically venetoclax, where we know in combination with proteasome inhibitors, combining it in patients who are 1114 positive confers remarkable clinical benefit. The important thing to note, though, is in those who are not 1114 positive, and this has to obviously be approached with much more caution, because in those patients, best as we can tell, the impact of the drug, unfortunately, is adverse. And so those patients should obviously not be exposed to venetoclax at this point. I think also from the molecular characterization of disease, we learn a lot more. For example, has the patient acquired 17p deletion? Because I think, as most of the audience appreciate, genetics in myeloma changes over time. So what your genetic characterization of the patient was at diagnosis can be fundamentally different at relapse. And so noticing if there's acquired 17p becomes very important, because then we know, obviously, we have a high-risk situation and can adapt accordingly. In that same spirit, if there's 414 translocation, 1416 translocation, these are markers of poor risk. We're now recognizing that 1q amplification is also associated with poor risk. Conversely, obviously standard risk is none of the above, and that obviously can be helpful as well in assessing the intensity of treatment that may be required. In terms of therapeutic options, as we think about 1q amplification or 17p deletion, or for that matter, 1416 and 414, integrating proteasome inhibition into the algorithm really does make sense. Integrating antibodies makes great sense. Optimizing the immunomodulatory-based platform also makes sense.